think we'll go ahead and get started. Thanks for attending. I'm going to present some information today about a new health carrier for you that'll start January 1st. Your pharmacy benefits will still remain with Express Scripts. So I want to confirm, first of all, does everyone have a packet? Okay. If not, let me know. Otherwise, let's confirm too that you also have the materials in the packet. So if you haven't opened up your packet, please do. First of all, you should have a copied packet that'll have a memo from me, also a welcome letter from Wellmark. On the back side of that, there's a news release, and then a copy of our PowerPoint today that Greg Ann Lowe from Wellmark will be presenting. Secondly, you should have two envelopes of ID cards. One is from Wellmark, and one is from Express Scripts. So we'll talk more about ID cards, but just briefly, if you need more ID cards for dependents or other family members that need cards, just let me know after the session. And then last, there should be a benefit enrollment guide. And this is just really informational for everyone. There's nothing in the guide that you need to complete. There's actually an enrollment form, but you do not need to complete it. So Greg Ann will talk more about the guide. I'd like to introduce to you Greg Ann Lowe. She's currently with First Administrators, and we've had the pleasure of working together for several years. And she's actually transitioning to Wellmark also, and we're hoping that we can keep her as our account manager. So Greg Ann Lowe?
I hope so. Good morning. Thank you for attending today. We will be brief. I know that you guys have a lot to do, but we just wanted to take the opportunity to touch base on a few benefit changes and as far as your carrier, but your actual benefits will not be changing. So we're going to just touch on that for a few minutes. And I'll just touch too that the reason that this change is occurring, and it's in your packet as well, is just with all the changes of healthcare reform that have happened. There have been a lot of government mandates, some of those which are software related, and that's a huge expense for companies. And so Wellmark has made the business decision to roll under one platform. So First Administrators is a wholly owned subsidiary of Wellmark, and so the good news is our network kind of mirrors the Wellmark network, and so you should not see any disruption with your providers. So we'll talk a little bit more about the network here as we go through the slides. But we thought we'd take the opportunity while we are meeting today just to kind of reiterate some of the benefit lingo and when you can become eligible to get on the plan. This is not your open enrollment period, so we are not doing an open enrollment right now, but there are times when you have an event in your life that may give you the opportunity to add a member to your plan. So who's eligible for your benefits? That's full-time active employees and retirees, your legal spouses, independents, if you're a full-time active employee or retiree. Independents are up to age 26 now. And something that does qualify for an event when you're outside of your open enrollment, marriage, divorce, birth of a child, maybe a spouse has lost a job, that does qualify as an event. So it's just a good time to remind you when you're able to add somebody to your benefit plan. Our network at Wellmark is called Alliance Select. Currently it's called Select First at First Administrator's side. And Alliance Select your plan is set up as a PPO plan, so you'll have fixed out-of-pocket cost, which we'll get into in a minute. You'll have the freedom to choose providers and receive benefits from those providers. The majority of the physicians in Iowa are in our network. And you'll have coverage in Iowa across the country and even around the world if you're traveling abroad, which is kind of an increase in benefit for you. Alliance Select in Iowa is 100% of the hospitals are in our network, so you don't have to stop and think about whether or not a hospital is in the network, which is really comforting. And then 99% of the physicians. So the odds are you're going to have a physician that you go to is going to be in our network. If you change physicians, do check and make sure that they aren't in the 1% that's not in the network, just to be sure that you don't incur extra cost. And then the Blue Card, you're now going to become a Blue Card member. which is a little bit of an increase in benefit, and that's where the worldwide comes into play if you are traveling abroad, or even if you're taking a trip to, say, Florida for spring break, for example, and somebody falls ill in your family or gets hurt, you'll want to check the Blue Cross network. But because it's so robust, 90% of the hospitals across the nation are in the Blue Card network, and 80% of the physicians. So there's still a really good chance that you'll be able to find a physician if you're traveling. And then finding a doctor or hospital within the network, you'll be able to make informed healthcare decisions, and then our network is going to be able to help you with that as well, and we'll get a little bit more into that in a few minutes. Thought we'd take the opportunity to just kind of understand some of the insurance lingo while we're getting together. It's a good reminder. Some of the common insurance terms that are used is your deductible. That's the amount you pay out of your pocket in a calendar year before the benefits are available. Fourth quarter carryover, your plan does have fourth quarter carryover, and I want to assure you that we will be transferring that over when we do transition you over to Wellmark, so that's good news. Your plan has a co-insurance, and so say you go to the doctor and you have a $100 bill from that doctor, it'll cost you $10. So you have the co-insurance but not the co-pay on your plans. And then out-of-pocket maximum is also a term that you may hear, and that's the maximum amount you pay for covered services each calendar year. So that's deductibles, co-insurance, those both apply to your out-of-pocket maximum. Another term is the provider network that you'll hear, and that simply just means all the physicians and healthcare practitioners, hospitals, facilities that are considered provider networks, so if you hear that term. Another term is preferred provider organization, which is also called PPO, and your plan is set up as a PPO. Even though you are self-funded, you're still considered a PPO plan. And the good news is that's in-network providers that are contracted with Wellmark, and they agree to pay Wellmark's payment. So that helps the city on their spending, which because you're self-funded, that's really important. It also helps you in keeping your out-of-pocket expenses as low as possible. And you're not subject to a deductible or for covered services that you receive in an office setting. So. There's also out-of-network PPO. So if you do go to a provider in Iowa that's not in the network, then you are going to pay more out of your pocket. The city's going to pay more as well. So just be aware if you decide to change physicians that they are in the network. And sometimes if you're out of state and you're traveling, you just, again, make sure that they are in the Blue Card network. Wanted to reassure you that your health plan benefits are not changing. So that's good news. We're just changing carriers. So we are transferring your plan over to Wellmark as it is today. So we've included that in the slide so that you can see that all of your benefits are remaining the same. Another slide, some of your plans have preventative care. So we wanted to touch on that to make sure those of you that have that, you know that those are not changing. Another thing that you will notice that's different from what you're at today, First Administrators does have a website, but Wellmark has a website as well, and I would have to say theirs is probably a little more robust. So once January 1st hits, you will want to register on mywellmark.com or wellmark.com. You'll see it referred both ways. And when you register, you'll be able to look at your claim status, you'll be able to view your eligibility, explanation of benefits. Sometimes you lose an EOB and you might need to turn in a flex claim. You'll be able to go out and print those off. You'll be able to find your provider network out there, access cost and quality tools, look up the quality care of a physician. So there's a lot of information on our website that is available to you, and it is really quite user-friendly. You can also drill down. My son had physical therapy from a sports injury. Some of you have probably experienced that with your own children. And just to see if it was all processing, I was able to go out and pull up this screen and make sure all of his physical therapy appointments came through. So it's just a nice tool to have if you're curious. You don't have to call your physician's office. A lot of times you can just go onto the website and look. There is a slide on wellness, and I apologize. City of Cedar Falls doesn't have this service right now, so you can cross through that one. I just wanted to make note of that. And then medical management. in Iowa, if you go to the physicians, our physicians in our network in Iowa are contracted that they have to, any pre-certification or pre-authorization, they know to call that in. I just wanted to bring this to your attention in case you are traveling and maybe you have an MRI or have to go to the hospital or have a procedure done. Just make sure you ask if they are making those calls, because outside of the state of Iowa, it really ultimately is your responsibility. So just wanted to touch on that. And technology can be a beautiful thing. And so if you have a smartphone, you might want to go out to your app store, type in the word Wellmark, search that. It's a free app. Put it on your phone, because after January 1st, this will be a nice tool for you. You can locate physicians and hospitals. It'll get you in touch with our personal health assistant, which I'll talk about more in a minute. You can check your claim status, and you can access your ID card, which is really nice, because I've been to the physician before where I've not had my ID card on me. If you have children that are in college or even in high school, I snapped pictures on our iPhones of the ID cards and just have them have that on their iPhone, just in case, because my kids are old enough to go to the doctor by themselves. And I have a daughter that's out of state in college, and that has come in handy. And you may even find it coming in handy if you take a picture of your ID card and put it on there if you don't want to download the app. And speaking of ID cards, Brenda mentioned we will touch a little bit more on ID cards. So you have your ID cards on you. Present your Wellmark card January 1st and after. Get rid of your first administrator card January 1st. Keep it until then. Replace it with the Wellmark card on January 1st. You also have a separate ID card for Express Scripts, because your pharmacy company is separate from Wellmark. So I guess there's an activation sticker on your Express Script cards. You can ignore that. That was put there on accident. So just know that those were activated internally. So you can peel those off if you want to while you're thinking about it. But and your pharmacy card, make sure your pharmacist, starting January 1, has your new ID card, because that's when sometimes you go and you get denied if you go to the pharmacy. It's because the pharmacist sometimes, even though you've shown them their card, double check and make sure that they've put that in. If you do have questions on your pharmacy, make sure you call the number on the back of your pharmacy card. If you have questions on your medical claims, look at the back of the Wellmark card and call customer service for that. You will be getting a new summary plan description after the first of the year. The good news is your benefits are not changing, so in the meantime, you can still refer to the benefit summary that you have now if you do have questions. Brenda will have hard copies of those when those are done, and she will also put them on your company intranet. So, but it is a legally binding document, and because you're going over to Wellmark, we will be printing new summary plan descriptions, otherwise known as benefit booklets. Then you will have a new looking EOB, explanation of benefits, and that's just showing your claim activity. You're probably used to getting those in the mail if you do go to the doctor. It just shows your financial responsibility after you go to the doctor. It's not a bill, but you can get those electronically if you don't want them in the mail. So you can go to wellmark.com and register for those electronically after the first of the year. And you'll also have a new customer service line to call on the back of your ID card. We do have automated service lines 24/7. We have live customer service reps during the day, and you can also go to wellmark.com to get a lot of your questions answered. And again, the back of the ID card will have the number. Another resource that's nice is we have a blue magazine that has, as you can see here, maybe has some healthy tips. A lot of people are trying really hard to make different lifestyle choices and healthier choices. You can go to wellmark.com and look at that magazine electronically if you'd like to. The personal health assistant, it's 24/7 line that I mentioned earlier, that has a nurse line on it if you need to call a nurse, or say you have a chronic health condition or have a serious illness and you need to go and have 3 or 4 doctor's appointments in one day. You can call that line and they will help coordinate those appointments for you. Maybe you're moving and you need your medical records transferred. You can call that number and they will assist you with that. I think that's really great, because if you've moved or if you've had several appointments, you know that would be really helpful to have somebody help you coordinate that. And then the last thing really is just the benefit booklet that you got, the green one, the benefits enrollment guide. Just keep that as a resource. It goes through the personal health assistant 24/7, our website, just EOBs. It's just a nice reference source for you. If you really don't want to go on to wellmark.com, you can pull that book out and it will have some good resources in there for you. You'll want to pay close attention to your benefits summary as you get a new one, but you'll also be able to use your current one until then. So, any questions? Any concerns? No? Okay, wow, you guys are easy. Yeah.
The prescriptions that we have in the mail order program, those don't have to be transferred. Those are with Express Scripts.
Right.
Whereas going to a pharmacy, we need to present the new card.
Just
Right.
make sure they have the new card, because currently your cards are combined and they're going to be separate now. And we want to make sure, I don't know if Express Scripts changed any numbers on those, but we just want to be sure that they have your current card. Just, you know, they could have assigned it the same number, but I don't know, I don't have any way of knowing that because I don't work for Express Scripts. So.
I did notice in your Express Scripts envelope, there is actually information for you to submit a prescription to their mail order service, I believe in St. Louis. So I think that was just informational, that if you want to start using the mail service, you can submit a new script, complete this form, and then tuck it in the envelope and send it to St. Louis. So that's what I know of. Okay?
Any other questions?
Greg Ann, you might just want to touch upon if benefits do
Correct. Thank
process differently.
Yeah, so in January, you'll have Wellmark as your carrier. Say you go to the doctor and you get, your claim comes back and it's denied. Please do not panic. I'm not saying this is going to happen, but just in case it does, let Brenda know. There's a whole new claim staff that's going to be processing your claims, and FAI has become accustomed to what maybe the city of Cedar Falls wishes are, because there are some benefits that are a little gray. And so if a new person processes your claim and they interpret it their way, but it's not really the way city of Cedar Falls meant for it to happen, just make sure you bring that to Brenda's attention, and then we'll look into that. And if it does need to be processed, we will make sure that that gets handled. Okay? Yeah. The good news is nothing benefit-wise is changing, so don't have to worry about that.
Yep. And just to reinforce, to use your new cards, show your providers, show
Very
your pharmacies, just get into the habit of doing that first month or more, especially those that don't use the benefits very often, which is great. You may forget maybe around March, you stroll into your doctor and there's your new card. So if you don't, you'll probably have a benefits denied communication given to you. So. Yep. All right, thank you.
Thank you for your time.
Lisa.
Things here that have been processed this last quarter that I have not and will be on, those will come from first administrators.
Yeah, and we'll handle the run out. So dates of service through 12/31, first administrators will handle those, even if it comes through in February. Okay?
Okay. Thank you.
Thank you.